I was born and raised here in South Jersey. I decided on medicine because I love science, but I love being around people, and I really love learning every day. So I wanted to find a career to do that. And I learn every day from my patients and from the community that I serve. A primary care provider is getting the foot in the door to the rest of the medical system, and there's also a comfort level and ease that you build with the primary care provider because they are the ones that you will see all the time. I hope if I send somebody to a specialist, it's just one time and we get them better, we get things resolved, or it becomes periodic because I can take over the in-between visits. In my arsenal or my toolkit, I have a lot of experience to know sort of where to direct things, both the problems at hand, whether it be diabetes management, high blood pressure management, or again, keeping up with their preventive care, making sure in the midst of all this, they might have many medical problems that I'm treating. And again, that builds a relationship. Sometimes that takes multiple visits. And sometimes I find things they weren't thinking of, or they'll remind me of something to look for in another patient. So that's how they teach me as well. I am the first Delaware Valley trained primary care sports medicine physician. So I have the benefit of having a little extra expertise in sports medicine, and this is a non-surgical sports medicine aspect. So I like to tell folks every active person is an athlete. If you're working an assembly line on your feet all day, you may get foot pain, and I would be somebody that maybe you could come see, and I could address it and do everything, up to the non-surgical, do everything that's needed non-surgically. With school-based health, I write policies with the school nurses. I am always available for consultation. I have to approve all the physicals for sports as mandated by New Jersey regulations. And then for high school sports, I'm a sideline physician. You need a sideline physician for football coverage. So I'm still covering high school football, which is great. I've been able to take care of generations of families in the South Jersey area for many years now. It makes it easy for me and for my patients to have very quick and easy access to specialists, imaging, the laboratory. I just feel in my own community there's a lot of need, and Inspira was starting to grow. They're well known here in the southern communities, but they want to have a presence and move up north, and I was very excited to be part of that expansion and be able to bring my expertise. They can bring all their resources to myself and my patients.